right, party people, we are back at it with some virology. Let's get it. So we have a 6-month-old female with stridor and an HIV positive mom. Now here is imaging from a fiber optic laryngoscopy. The reason this is shown is because I want to draw your attention to the laryngeal papillomatosis. Here, the diagnosis is HPV, that's human papillomavirus, specifically types 6 and 11. These infect your vocal cords and form wart-like lesions. This is a known pediatric presentation and is definitely fair game for your licensing exam. Now, there might be other versions of this type of question where they just want you to identify whether it's HPV 6 or HPV 11. Simple, straightforward. However, here, I'm giving you the options where you have to pick is a DNA, RNA, enveloped or naked, or circular or linear. So let's break it down. Now, you have to know that HPV is a DNA virus. From there, we're going to go, is it enveloped or non-enveloped? The term naked just means non-enveloped. They can be used interchangeably. Now, HPV is in fact non-enveloped. Finally, is it circular or linear? HPV is circular. So the correct classification is DNA non-enveloped, aka naked, and circular. Now, two other viruses that you have to know with the same structure are JC virus. This causes PML, that's progressive multifocal leukoencephalopathy, especially in immunocompromised patients, as well as BK virus. This is commonly seen in renal transplant recipients. This causes renal and uroepithelial damage. Now we're going to run through the other viral structure options. Now this is where they might try to trip you up, so let's see if we can lock in. So DNA enveloped circular. This is hepatitis B. You have to know this. Even though it's a DNA virus, it replicates via reverse transcription. Now in terms of DNA enveloped and linear, this refers to the entire herpes virus family. So when I say that, we're talking about HSV1 and HSV2, VZV, that's varicella, Epstein-Barr virus, and cytomegalovirus. We have HHV6, that's known as roseola, HHV7, as well as HHV8, that is Kaposi sarcoma. This is very high yield. They'll often show you a picture of herpes labialis. Instead of asking you to identify HSV, they'll ask for viral structure. So you'll have to pick DNA, enveloped, and linear. Now, as far as DNA naked and circular, this is where we have HPV, JC, and BK viruses. As far as DNA naked and linear, this includes parvo B19, the single-stranded DNA virus which causes fifth disease, aka slap cheek rash in children. Also, we have adenovirus. This is a double-stranded DNA virus causing viral conjunctivitis and hemorrhagic cystitis. Now, in terms of RNA viruses, if it's RNA enveloped and circular, you have to know that this is an arenavirus, such as LCMV. This causes lymphocytic choriomeningitis, or Bunya viruses, such as Crimean Congo hemorrhagic fever, hantavirus, and this causes hemorrhagic pulmonary syndrome. Now, these rarely are tested on your licensing exams, but I'm including them for the sake of completeness. Now, as far as RNA enveloped linear viruses, this is a large category, so let's focus. Here we have coronaviruses. We have paramyxoviruses such as RSV, parainfluenza, mumps, and measles. We have orthomyxoviruses such as influenza. We have rhabdovirus for rabies. We have retroviruses such as HIV and HTLV 1 and 2. We have flaviviruses, that's hepatitis C, West Nile, Zika, yellow fever, Japanese encephalitis. We have toga viruses, that's chikungunya, Eastern and Western equine encephalitis. This is a high-yield group, you have to know these. As far as RNA, naked, and circular viruses, this is not a very widely recognized category, but sometimes it can refer to rotaviruses, which is double-stranded RNA. You have to know that it's segmented into 10 or 11 segments and non-enveloped. This has a wheel-like morphology. They'll give you a child with watery diarrhea and say the virus has wheel-shaped appearance. You have to know that this is a classic clue for rotavirus. Now, as far as RNA, naked, and linear, this includes enteroviruses such as Coxsackie A and B, poliovirus, and echovirus. We have hepatitis A virus, calcivirus. An example of this would be norovirus. We also have reoviruses, such as we have cultivirus. This causes Colorado tick fever. Now, this particular question is important. However, if you're just trying to pass your exam, don't worry too much about it. But if you're trying to score extremely high, this will separate you from the rest of the pack. All right? If you like the video, give it a like, share with a friend, subscribe, and I'll be back with another one. In the meantime, go crush it.